Hola, muy buenos días.
Good morning, good afternoon to all of you. Welcome to the Pan American Health Organization's press briefing. PAHO, today, Wednesday, April 4th, May 4th, 2022. My name is Luciana Viegas. I am with the Communications Department here at PAHO. We have interpretation into French, Spanish, and Portuguese. You will use the Q&A button to send your questions. We'd like to thank the journalists who send the questions ahead of time. So when you send your questions, please indicate your name and media outlet too. Today, PAHO's director, Dr. Carissa Etienne, will be updating us on the situation of COVID-19 in the region, and will also be referring to the situation of health workers after 2.5 years of pandemic. Jarbas Barbosa joins us today as Assistant Director for PAHO, Dr. Ciro Ugarte, Health Emergencies Director with PAHO, and Dr. Enrique Perez, Current Incident Coordinator for COVID-19 at PAHO. So we start with the opening remarks of our director, with her opening remarks, and then we move on to the questions. So I give the floor to PAHO's director, Dr. Carissa Etienne. Doctor, you have the floor.
Thank you very much. Good day, and thank you for joining today's press briefing. Last week, our region reported more than 616,000 new cases, a 12.7% increase over the previous week, and more than 4,200 deaths, a slight drop of less than 1%. The Caribbean reported a 15.4% increase in new infections, with cases rising in 24 of the 34 countries and territories, and deaths in the Caribbean increased for the third consecutive week by 39.6% as compared to the previous week. Cases continued to rise in Central America, this week by 53.4%, with 3 out of 7 countries reporting increases, even as deaths continued to decline. In North America, cases increased for the 5th consecutive week, rising 19.5% in comparison to the previous week. The United States reported a 27.1% increase, while Canada and Mexico reported declines in new infections. Both the United States and Canada saw a rise in weekly COVID-19 hospitalizations. In South America, there was an overall decrease of 8% in new infections, although 7 of the 10 countries in that region reported increases in cases. 11 countries and territories across the region reported an increase in hospitalizations and increases in admissions to intensive care units. COVID-19 cases and hospitalizations are rising in far too many places, which should prompt us to strengthen our measures to combat the virus, including surveillance and preparedness. It is crucial to keep our eyes on the virus by monitoring its evolution and maintaining adequate testing capacity. Good data on what is happening can help each country plan preventive measures, communicate effectively with the public, adjust preventive measures, and reinforce hospital capacity if needed. Vaccines, however, remain our best resource to save lives, especially when cases rise. Data from the Public Health Agency of Canada shows that in the month of March, unvaccinated youth and adults were 3 times more likely to be hospitalized with COVID-19 than fully vaccinated people. The risk is even higher for unvaccinated people over the age of 60. We must reach those who remain unvaccinated with the full COVID-19 vaccine primary series and ensure access to boosters, especially to the most vulnerable. Since COVID vaccines became available, we have delivered 1.8 billion doses of COVID-19 vaccines in the Americas. Over Vaccination Week in the Americas last week, we managed to deliver more than 12 million doses. And this is remarkable progress. We must maintain this momentum to reach the 230 million people who remain unvaccinated in our region. You know, we never would have reached this many people without the essential work of nurses throughout the Americas. Ahead of International Nurses Day, we want to thank the nurses who have helped achieve these milestones and played a central role in caring for those that fell ill from COVID. It has not been easy. Throughout the Americas, nurses bravely faced the brunt of the pandemic, and many struggled from burnout and mental health conditions. The COVID-19 healthcare workers study showed that almost 1/4 of health workers who were interviewed in 2020 presented symptoms of a depressive episode, and as many as 15% reported ideas about committing suicide. In some countries, only about 1/3 of those who needed psychological care could receive it. In Brazil, Guatemala, and Colombia, more than 1 in 10 members of the health workforce had symptoms of severe depression. Today, nurses shoulder the dual burden of caring for COVID patients and catching up those who have missed routine health checkups over the past 2 years. These overlapping stressors cause some to move away from their home areas, leaving hospitals and health centers drastically understaffed. In one global nursing study, 4% of nurses even said that they intend to leave the profession because of the pandemic. Nurses are the backbone of our healthcare workers, making up 56% of our staff. We rely on them to provide primary care services, mental health support, and protect the well-being of individuals, communities, and families. When nurses face difficulties doing their jobs, the entire health system suffers. And that is why we need to double our investments in growing our nursing workforce and to care for existing nurses so they can continue to care for us. To meet our health needs, PAHO estimates that the region of the Americas will need 1.8 million more nurses by 2030. The United States will need to add 1.2 million nurses to its workforce, and Canada will need 60,000 more by 2025. To reach this growth and to retain our existing nurses, countries must have clear policies to develop and retain the health workforce. Countries can improve governance by creating more senior leadership opportunities for nurses and elevating nurses and midwives within the government and ministries of health. Jamaica is working on a new national nursing and midwifery strategy to better regulate the workforce and plan for the future of the country. Brazil aims to raise the minimum wage for nurses to ensure that they are adequately compensated for their essential work. We also need to treat nurses with the respect and dignity that they deserve and to support their mental health. In a study done in the Caribbean, PAHO found that about 45% of nurses left their jobs for better working conditions. Countries and territories, individually and in partnership with PAHO, are making efforts to address this issue. Nursing associations are calling for countries to provide mental health services in health centers to take care of medical workers' mental health. Chile and Argentina have created hotlines to support the healthcare workers' unique mental health care needs. And PAHO is rolling out a self-care course catered specifically to health workers. It is true that the pandemic has challenged the mental well-being of all of us, not just the health professionals. On this topic, therefore, I want to mention that PAHO is launching a high-level commission on mental health and COVID-19 on Friday, May 6th. This commission will bring together leaders and thought partners to take a closer look at the impact of the pandemic on mental health in the Americas. We have also included persons who suffer from mental health. It will guide PAHO and its member states to strengthen our efforts to meet mental health needs across our region. COVID-19 continues to put a spotlight on the gaps that we must address, directing our efforts to build back better and fairer in all aspects of our health systems. I invite you to also join PAHO for the International Nurses Day celebration on Friday, May 6th, to call for sustained investment in our current and future nursing workforce. We must grasp this chance to strengthen our health systems and health workforce across the Americas to ensure that we are not only protected from this virus, but can all live happier, healthier lives.
Thank you very much, Dr. Etienne. Pasamos ahora a las preguntas que nos enviaron.
We'll move on to the questions that we have received ahead of time and that we're also receiving through the Q&A button. We start with a follow-up question for the director.
You said COVID cases and hospitalizations are rising in your remarks and should prompt strengthen measures. Can you explain what you mean by that? What would be such measures? Thank you.
Well, let me thank you for that question. It is particularly important to protect our health workers against getting infected because the COVID-19 pandemic is not yet over. Variants of concern are still circulating, and we may see a resurgence of cases and deaths at any time. Each country, therefore, should be prepared to respond quickly on public health and social measures if their cases and hospitalizations increase. And for nurses, doctors, and other health workers who have been heavily affected by the pandemic, we must do everything that we can to ensure that they are protected. And this means getting our health workers the highest quality available masks and other personal protective equipment. It means ensuring that our health centers are well ventilated and equipped with adequate air filtration and water for hand hygiene. Of course, health workers are a priority group for vaccinations, along with the elderly, the immunocompromised persons, and pregnant women. So we urge countries again to focus on getting these groups fully vaccinated, including the booster doses. When our health workers are well protected, we can help them by continuing to minimize our risk of exposure to the virus. And this means avoiding closed spaces and continuing to wear masks indoors where people congregate. It also means staying home when sick, increased hand washing, and improving the ventilation of indoor spaces, even in periods of low circulation of SARS-CoV-2. These simple measures minimize virus transmission between people and reduce the changes of a new variant emerging. These work, and we have the proof that they work. These steps protect not only our health workers, but also our families, friends, and neighbors. Let me again reiterate, please remember, we are still in a public health emergency of international concern. And we must remain vigilant, and we must be prepared to quickly scale up public health and social measures if the rates of hospitalizations and deaths start increasing again. Thank you.
Thank you very much, Dr. Etienne. Pasamos a las preguntas.
We now move on to the questions by other journalists. We have a question in English by Mitra Taj from the New York Times, Peru.
First, Peru's health minister recently acknowledged booster shots of of the vaccine indicated by the WHO, the FDA, and Peru's own drug mid. After an increase in reports of side effects, the ministry reduced the dose, but has not provided a detailed explanation. The questions are, did Peru consult PAHO on this decision? Does PAHO know how many people received the dose of vax? And if other countries have also given COVID vaccines with larger doses than indicated? Dr. Barbosa.
Thank you for this question. It's important first to recognize that the vaccines against COVID has now been administered for billions of people in the world. And of course, that the operational mistakes can happen. To prevent them, it's very important to provide the information for healthcare workers, to training, to supervise their work. Yes, for the question, we received the information from the Ministry of Health of Peru that the operational mistake had occurred in the country. This is understandable because the Moderna vaccine is the only vaccine that the booster doses should use only half the doses that is used for the regular immunization. All the other vaccines use exactly the same doses. So when this happened and the Ministry of Health discovered this, it immediately suspended this administration and started using the recommended half dose, informed the PAHO. We are working with the Ministry of Health to understand better what happened and to share more information with all the health worker teams. But we don't have any kind of increasing in side events or specific negative side events reported among the people that received this increased doses booster in Peru. And of course, this recommendation to use half dose is the better and more rational use of the vaccines, but the FDA, for instance, recommends the use of full doses of the Moderna vaccine for immunocompromised people. So we really don't expect that these persons have any higher risk to develop a negative side event. But again, it's important to learn with this lesson and to provide more training, more information for the healthcare workers. Thank you.
Thank you, Dr. Barbosa. The second question from Mitra is, Dr. Etienne said at the last press conference that COVID had become the leading cause of maternal deaths in some countries. What countries are those? And could you say more about what is known about the relationship between maternal deaths and COVID? Dr. Barbosa, we stay with you.
Thank you. Thank you for this question. As our director presented in our last press conference, we are now working with the data provided by the countries for the year 2021. But we have solid information from Brazil, Colombia, Ecuador, Mexico, and Peru, confirming that COVID-19 was one of the most important causes of maternal deaths in 2021. And we don't expect to have different data from the other countries in Latin America and the Caribbean. I think that this is to highlight the relevance that we need to have in each country for pregnant women. The causes are different, but the first cause and main important is that pregnant women have a higher risk to develop severe cases of COVID-19. For this reason, they should be vaccinated. It's very important that during the antenatal consultations that the nurses and physicians talk with these women, with their family, to provide all the information to support the decision of these women to get vaccinated and to save their lives. But we have had also some important variants during the year 2021, during the peaks of the transmission in many countries. Services were totally or partially disrupted, so some women haven't had the access to antenatal care, and also they had difficult to access hospitals and ICU beds when they need to get them. So these are the main causes of this epidemiological situation. And again, this is, I think, that a very important reminder to get pregnant women vaccinated and to develop strategies to keep the services running during the peak of cases. health services need to be more resilient, need to adapt and to adopt the strategy that they can get receiving people that need their service. Thank you.
Thank you, Dr. Barbosa. Pasamos a una pregunta
We now move on to two questions from Mexico. Blanca Valadez from Millennium has the first question. What type of notification, what type of notice have you received from Mexico about the epidemic reduction? Could it be considered as the end of the health crisis? Dr. Ugarte. Thank you, Luciana. Thank you, Blanca, for that question, which also applies to many other countries that are presenting a much lower number of deaths and cases over the last couple of weeks. But the Federal Health Secretariat of Mexico has communicated the end of the priority care of the pandemic, the close of the pandemic cycle, and also the transition to the endemic state of the COVID-19. This analysis was based on the fact that over the last couple of weeks, the number of cases has reached very low levels, and the same applies to the number of deaths. But the Health Secretariat in Mexico, since it is constantly monitoring the situation of the new cases and also the number of deaths, has reported that after 2 weeks of a continuous drop, Mexico has seen a mild increase in the number of cases and deaths over the last 2 weeks. And over the last 5 weeks, most of the cases are in the 18 to 29 group, followed by the 30 to 39 and 40 to 49 age groups. That is to say, the groups that have the lowest vaccine coverage as compared to other higher or older groups. And it has also said that 59% of most of the cases has been among women and 62% of the deaths have been in men. As to the hospital bed use, it has been reduced to 24% use and 1% occupancy in case of beds with respirators. So these figures are extremely low, that are the cause for optimism throughout the population and throughout the world, as expressed previously. The number of cases is as low as we have seen it. But in this context, and also given that we have seen these conditions before, we think that we are in an interpandemic period. As a matter of fact, we recommend not to relax the measures because we see that in many countries in North America and many other countries, we see a resurgence of new variants of concern and also sublineages that are the result of more opportunity for virus transmission. The population is more relaxed, and then the physical contact also allows for the virus to be transmitted. So at very low levels, if we allow the virus to be transmitted, for example, during Holy Week or also during other events, clearly the virus will take advantage of the opportunity. And whenever it is transmitted from person to person, there is a higher probability for mutations, changes, sublineages. And one of those sublineages could be a variant causing a health situation or a clinical case that is more serious, and we would not like to see that surge or that uptick in the number of cases. So we recommend the population to secure access to vaccines. Please get vaccinated, please get boosted, and also get what you need. And also verify your own health status as well as the health status of your surrounding environment. This is extremely important. Still, the range of positivity, and we see that the number of tests is decreasing all over the world, is still high. So it is likely that this situation may prolong, and we expect that the cases will diminish and that the countries will declare the end of the emergency phase for the pandemic. As we have expressed before, the declaration or the consideration, the evaluation as to the pandemic situation is an evaluation held globally. This is done by WHO, and also the emergency declaration. The emergency declaration in the area of public health is based on a declaration by the director of the WHO, as well as the recommendations by the committee overseeing the international health regulations. So at the global level, we are still in the midst of a pandemic of worldwide relevance, and we need to implement all of the measures for this to continue to be reduced. Thank you very much. Thank you. We also have another question by Blanca. This is a clarification as to the number of vaccines sent to Mexico, and she's saying that there are some batches of the vaccines that are about to expire in April. Therefore, there was an accelerated process that was implemented, and others that are expiring in May. Do you have a clarification, Dr. Barbosa? Yes, thank you for the question. Between May 1st and the 4th, Mexico received a historical shipment, more than 18 million doses of AstraZeneca that the revolving fund delivered on behalf of the COVAX facility. Mexican authorities, in coordination with the provider and also with COFEPRIS, that is to say the regulator in Mexico, established the schedule for vaccination based on the expiration date for each batch. During the month of March, those vaccines were used as part of a vaccination effort for individuals that needed to complete their schedule, and they also needed the first booster of their primary system, and that allowed for more than 13 million vaccines to be administered in March, and the Health Secretariat in Mexico is updating the use of these vaccines for the upcoming months in May and June based on the expiration date of each batch. And it is also important to say that Mexico has COFEPRIS as a regulatory authority that can carry out the tests, and also coordination with the provider, extend the use as done by the regulatory authorities all over the world if that's necessary. Thank you.
Gracias, Dr. Barbosa.
Thank you, Dr. Barbosa. Now we have a question from Ana Lucia Ola from Prensa Libre Guatemala. Two questions. First, in Guatemala, about 35% of the population has had a full schedule of vaccination against COVID-19 to doses, and children have yet to be vaccinated. How high would be the risk of a new increase of positive cases with appearance of new variants, and also taking into consideration that the use of masks has been left to the discretion of the population? And would it be prudent to adopt these measures, or was it prudent, since we are so far from reaching the 70% vaccination target of WHO? Thank you, Ana Lucia. Guatemala has made great efforts to advance in the process of vaccination. In fact, they are far from reaching 70% of the population being vaccinated. Yes, and they already have started with children over 6 years in their vaccination schedules. Regarding decisions made by countries, in the case of Guatemala, they have considered that the risk to eliminate, or the risks based on public health measures, is based on the level of community transmission. So there is about 662 average new cases in Guatemala in the whole country, but the mean positivity, according to tests, is around 8%. And the percentage of beds occupied is about 10% in hospitals. No increases, significant increases have been observed vis-a-vis other waves of high transmission. And as we said before, in the case of Mexico, and it applies to all countries, it is important to be ready, doing an oversight and have surveillance, do tests, especially when you relax the public health measures and the physical distancing and other measures, including, of course, the recommendations for the correct, adequate use of masks in closed spaces, but in particular to verify the country's capacity and make a proper decision maintaining active surveillance of suspicious cases, isolation, quarantine when necessary of contacts, and in that way we will be able to advance together in this process. Guatemala, as well as other countries in Central America, are vigilant following the global situation, and they'll see how these decisions may be adjusted based on community transmission of COVID-19. Thank you. Thank you, Dr. Ugarte. Second question from Ana Lucia is, could you talk about long COVID in children? What is the clinical picture you're seeing in children, Dr. Perez? Yes, thank you very much for this question, Ana Lucia. Well, let's see. Symptoms, persistent symptoms in adults since COVID-19 appeared and post-COVID condition are increasingly appearing in the literature, but we are lacking data and information about children to this point. We could say that the pediatric population has shown two sequelae of COVID-19, the multi-systemic inflammatory syndrome and the post-COVID syndrome or condition. It's less defined because there is absence on the agreement of duration and severity of symptoms. So the true prevalence of post-COVID in children is something that is as yet uncertain. We know that with the appearance of the Omicron variant, which seems to be more infection, that the prior waves of COVID-19 have led to more children being infected with the virus, although post-COVID condition can only affect a relatively small portion of children. Numbers are still considerable. As with the adults, asymptomatic children or children who are mildly infected can also develop post-COVID condition or symptoms, which are relapsing or can be. The most widely reported symptoms are the same: fatigue, cognitive deterioration, joint pain, anxiety, and depression. So pediatric post-COVID condition is seen more in older children, in female children, and in those with allergic problems or other underlying chronic disease. While most children recover quickly, some suffer from persistent diseases, disabilities, and they could have long absence from school. It is suggested that the COVID-19 vaccine is associated to lower risk of having post-COVID conditions. So research is being done in children to confirm whether this effect also exists, this protective effect exists in children too. And finally, I would add that it is important that it's important to warn people that if post-COVID condition is defined by the symptoms that appear within a specific period of time, it doesn't mean necessarily that the child should wait before medical care is offered, because this could have long-lasting, long-term effects. WHO PAHO is supporting countries to develop guidelines, and we've said this before, for clinical care and better identify people with post-COVID condition. And we think it is important to continue to study them to be able to make the connection between the virus and the description of the clinical pattern, and therefore be able to have guidelines for clinical or medical treatment of these patients. Thank you. Thank you, Dr. Perez. Now we have a question from Nicaragua. Gabriela Solórzano, Noticias 12 from Nicaragua, ask several questions, or two questions. In Nicaragua, there is a national national vaccination campaign, including 17 diseases, including COVID-19. Could these or should these vaccines be given separately, and what are the guidelines for countries? Dr. Barbosa, please. Yes, thank you very much for your question. First of all, let us recall that last week, PAHO celebrated the Vaccine Day in the Americas, 20 years of it. And this is an appeal to countries to bring up to date the vaccination schemes that where there is a lag due to the pandemic. There are different vaccine days and campaigns in order to reach the populations that have difficult access to medical services in different areas in the countries. And the health ministry in Nicaragua and all the health ministries in the Americas received through PAHO the recommendations to use vaccines and it can be given with the COVID vaccine. You can give it with other vaccines, but there are guidelines which are known by the countries and implemented. And there's also recommendations that COVID-19 vaccines can be given together with influenza vaccine. And this is an important initiative in order to be able to catch up with those who stopped vaccinating. And both in Nicaragua and all the other countries, there are recommendations and guidelines for using these different vaccines. Thank you very much. Second question from Gabriela is regarding the new variants, XD and XE. Do you and PAHO have any confirmation of having found it in Central America? Dr. Perez. Yes, thank you very much for your question. First of all, let me tell you that thanks to the work and permanent effort of countries in the Americas and the active participation in the genomic surveillance network, it's been possible to generate too far over 300,000 sequences that have been deposited in global networks. And we've seen circulation over time of the different variants of concern, including Omicron, which is the predominant right now, both regionally and globally thus far. In Central America, the only country that has reported an event of recombination, which is what the question is about, has been Costa Rica through their sequencing center, genomic sequencing center in Costa Rica. While sequences are very similar to XE, which is a recombination between sublineages of BA.1 and .2 of Omicron, we're still analyzing the composition to give a definitive classification. It's important to recall that these recombination events are common in the evolution of viruses, and so far they have not demonstrated an advantage for the virus in terms of transmissibility, and they have not been associated to greater severity with changes in clinical behavior. And I think this is my answer. Thank you. Thank you, Dr. Perez. Now we have the question from Javier Hernandez Garcia from Telesur, Mexico. Two questions, quick questions maybe. What progress is there in approval for the use of Cuban vaccines, Soberana 1, Soberana 2, Soberana Plus, and Abdala? Why has this been restricted if it has shown to be effective for the population in Cuba? Dr. Barbosa. Yes, thank you for your question. Again, it allows me to speak a little more about the process used by the WHO to assess and give an EUL to vaccines. First, for us in PAHO, it's important to strengthen the capacity to produce vaccines in Latin America and the Caribbean. Vaccine manufacturing is concentrated in certain parts of the world. So Cuba's effort is very important, not only for Cuba itself, but for the region. And we always support dialogue between the producers and the pre-qualification team at PAHO at WHO, excuse me, so that they can have all the data and they can submit their dossier and their after the evaluation receive the EUL. This is on underway because to grant a EUL, there is an expert committee that is set up, both internal and external experts from all the most important regulating agencies in the world, and they assess the dossier which includes all data about the quality of manufacturing of the vaccine, the clinical trials that were carried out, phases 1, 2, and 3, to ensure that the vaccine is both safe and efficacious. And so for the Abdala vaccine on April 30th, they had the first official meeting of pre-submission, and Geneva is setting up the group of experts, and then they will start reviewing the dossier. So the process is underway. I repeat, this process is the same, and we hope it will be completed soon, because all the vaccines with an EUL can be used then freely. We are interested that all vaccines are submitted to this process, which is a scientific review process. It's not only red tape. You put your submission, and it is a very serious scientific review process. It must be followed by everyone. Thank you. Thank you, Dr. Barbosa. Now we have a question with a different topic: acute serious hepatitis in children. 2 weeks ago, there was an alert from WHO about this, and we will combine these questions because they are coming from Agencia EFE, Televisa Mexico, Comercio Ecuador, Esto es Brazil, and Reuters. So we're going to divide them in two parts. First, are there reports of cases of acute serious hepatitis in children in the Americas? What are the recommendations for monitoring and surveillance of possible cases and prevention thereof? And what is the risk level for our region? Dr. Perez, please. Yes, thank you very much for your question, and this topic is very relevant. Allow me to give you a little bit of context so that we are all on the same page. If you remember, this question was asked 2 weeks ago, and we had reported that starting April 5th, 2022, WHO was notified through the HR of these cases of acute serious hepatitis of unknown etiology in priorly healthy children in the UK. After the initial reports, there are 228 probable cases that have been reported by 20 countries, mainly in the European region, but also some in the Americas and in the Western Pacific region, as well as in Southeast Asian region. This includes the 9 reported cases in the United States here in the Americas. It is important to emphasize that in this event, the most frequent causes of hepatitis, which are A, B, C, E, and D viruses that cause hepatitis, have been excluded after lab tests. So more research is being done to fully understand the etiology of these cases. Let me refresh your memory and give you more context. This clinical syndrome of identified cases is an acute liver inflammation where we see very high liver enzymes, and there is jaundice, and also preceded by gastrointestinal symptoms, pain in the abdomen, vomit, and in children up to 10 years old. No other risk factors or epidemiological risk factors have been identified, including recent international travel. 19 of these children have been submitted to liver transplants. And we have information that sadly, at least one child has died out of the reported cases. As I said, the etiology of current cases of hepatitis is still considered unknown etiology, which is still being researched. Lab tests are being done for other things, toxins, chemicals, and other pathogens. Determining the etiology is very important to better inform the measures we eventually take for prevention and control. The hypotheses related to side effects of COVID-19 vaccines are excluded because most of the children who have been affected by this did not receive COVID-19 vaccines. So PAHO's recommendation to the countries is to keep informed and monitor cases. PAHO is providing technical support to countries in the region in generating and disseminating opportune information during while the research is going on. We have published a briefing note and a section of Q&A or of FAQ, frequently asked questions, on our website, and we are in close communication with those countries who have requested support. For example, Costa Rica, with the surveillance department, they have generated an alert for medical groups, and they are following the behavior of this condition. We will also join forces with other countries in the region to support their research. I think this answers the questions asked by the journalist in this regard. Thank you, Dr. Perez. I think you talked about the connection to, or possible connection with COVID-19 vaccine. There are more questions about this, the relation between hepatitis in children and COVID and the measures taken for the pandemic. So Martin Vargas from Reuters, Mexico, asks, is there any connection between the cases of hepatitis and the COVID vaccine or with the disease itself? And Claudia Luna Palencia from Vertigo, Spain, asks, perhaps if you using so many severe hygiene measures with masks, we don't go to crowds, etc., being homebound, could this lead to resistance, natural resistance vis-a-vis other viruses, bacteria, and pathogens, and make them more resistant and harmful to people? Thank you very much for your question. Yes, in the research that is being done, they are working on the likelihood or possibility that there has been circulation of the virus that has been detected in some of the patients, which is the adenovirus, during the pandemic and exposure. This is part of one of the theories that we are investigating right now. And part of the research, as I've said before, adenoviruses have been detected in some of the cases, and this could be related to an increase in activity of this adenovirus observed recently in the countries. And also, it is clear that, or I should say, it's important to say that adenoviruses are common pathogens that usually cause a self-limited or self-limiting infections. The dissemination of adenoviruses from person to person, and they frequently cause gastroenteritis, sometimes conjunctivitis or respiratory diseases, but it's not clear the pathogenesis, and it does not clarify the situation with the clinical picture with the hepatitis. So this is why this is being investigated and researched. I should add that the infection due to this adenovirus, especially type 41, which is the one that has been found, it affects children, and it's been reported in the literature that it affects immunocompromised children. However, we don't know that adenovirus is causing or causes hepatitis in healthy children, which is what is happening. Regarding the last part of the question regarding the measures of hygiene, let me clarify that pathogens such as viruses and some bacteria obviously need a human being to subsist and survive. And so during the periods of isolation or social distancing, their circulation has decreased, and also their evolutional or adaptation mechanisms have changed. And we should also emphasize that once the control measures, public health measures are lifted, and we come to contact with these agents, the human immune system is designed to respond very quickly and readapt to them through memory mechanisms, and in this way maintain protection efficiently. And therefore, it is necessary, in addition to, or we, we should stress that it is necessary to maintain regular vaccination schedules in those vaccine preventable diseases. And I think this is my answer to your questions. Again, research lines that we're following are it's following the susceptibility in children after the pandemic. Now, co-infection with the COVID-SARS-2 is one of the hypotheses that we are following, and the emergence of the adenovirus. But I think this is my answer to your question. Thank you. Thank you very much, Dr. Perez. This is very important for parents in the region. Now we have a question about avian influenza, which Blanca Valadez also sent. There was an alert of possible cases in farms of avian influenza H713. What do you know about the situation, and is this of concern, Dr. Ugarte? Thank you very much, Luciana and Blanca, for this question. In the National Health Service and Safety, SICA, it confirmed a high pathogenicity avian flu, AH7N3, in the municipality of General de Cepeda in Coahuila. So the SICA did a quarantine and slaughtered 70,000 birds. The lab confirmed that it is a strain reported in some areas of Mexico back from the year 2012. So it's not a new strain. April 27, the Coahuila Health Services reported that 2 workers started showing symptoms of acute respiratory disease, and these were workers who were in the area where avian influenza was reported, and pharyngeal nasal exudates were taken as well as serology, but the presence of the virus was ruled out. So health services from Coahuila at this point in time rule out the presence of a presence in humans. Senacica and the health services of the state of Coahuila and the federal level are in close connection, as well as the National Institute of Diagnostics. I'd like to take this opportunity to emphasize the importance of being alert to all outbreaks, not only of acute respiratory diseases, but of new events that may generate a public health emergency, potentially. Not this case, which clearly has been ruled out and discarded, but it shows the degree of maturity that we have in the health system in Mexico to detect these cases, and the quick coordination among all levels in case this could have a repercussion in humans. The greatest risk for the next pandemic continues to be the influenza virus, the human influenza virus, and the greatest probability is that the influenza virus will come from the agricultural areas. So it is very important to do this surveillance and continue with these processes because this is the most important measure of protection. Our region has been characterized for having a genomic surveillance network for COVID-19, but this same network of labs can continue to detect new variants and new viruses. And if there is one in a country, we can quickly share that information, and the countries should be on an alert to be able to detect it in time. And this is one of the advantages and the greatest advances in our region. And I think it gives us a better position to be in when we have a future health emergency. Thank you. Thank you, Dr. Ugarte. A follow-up on influenza. Frederica Charino in Uruguay, Búsqueda. Now, the cold weather is starting in our area, and this leads to more circulation of influenza. How could we prevent a double infection by COVID-19 and influenza? Can we combine the two campaigns of vaccination against flu and COVID-19? Thanks for your question. Yes. Of course, we know that in the southern hemisphere, during their winter, which is starting, is when they have more flu, and there are campaigns for the flu vaccine. Flu is responsible for hundreds of thousands of deaths every year in our region. Due to complications after influenza, especially for people who have a compromise of their immunological system, or people with comorbidities, the elderly, etc. So it's important to remember that it's not only COVID-19, which is a risk, but also influenza, which is a big risk. The way to protect against influenza is similar to that of COVID-19, hand washing, hand hygiene, use masks when you are indoors, and vaccinate everyone according to the recommendations of the health ministry. For most vaccines that we have today for COVID-19, we have data and evidence that say that you can be given, that they can be given together, both flu and COVID-19 vaccines. And this, it widens the access. More people can be vaccinated. So yes, countries can adopt this strategy with something that is more rational and guarantee better access to people to these equally important vaccines. Thank you.
Muchas gracias, Dr. Barbosa. Llegamos casi al final de nuestra sesión. Hoy tenemos una
Thank you very much, Dr. Barbosa. We have a question at the end. This is another follow-up question in connection with the Mental Health Commission. This is Paula from Lima. We referred to a commission to address the impact on mental health during the pandemic, and whether we have any information on this system, and if we could share information on this commission. Dr.
Asking for more details, or if you have any conclusions on mental health as a follow-up to your statement that we will be launching at the Mental Health Commission at the end of this week. Please. Thank you.
Thank you, Etienne, and thank you, Paula, for that question. As the COVID-19 pandemic continues to affect our region, with disproportionately high rates of illness and deaths, what we have seen is a concurrent mental health pandemic, and this has been well recognized in our region. Higher rates of mental health conditions, most specifically depression and anxiety, have been reported in many countries in the region. The mental and neurological symptoms that are associated with post-COVID-19 conditions are also becoming an evolving challenge. We see continued disruptions in services for mental, neurological, and substance use conditions, and this is another problem for our countries. As mental health conditions are rising, we saw that there were breaks in the mental health services. So effectively addressing mental health impact of COVID-19, we think is essential to post-pandemic recovery and to safeguarding the progress that we've already achieved in this region today. We have seen the effects of the pandemic on mental health. So now let's see what we can do together to catalyze mental health reform and to build back better. To build back better, we need more resilient mental health systems and services for the long term in the Americas. Now, we must recall that even prior to COVID-19, our mental health services were already weak, and COVID has struck a double blow, so to speak, and so this is an area that requires significant attention. But let me remind you that this is not only a health system problem. It is a problem for all of society. And so that's why we have convened this commission. We have leaders from various countries and organizations who will study the changes that are needed to strengthen mental health and make proposals on financing, health promotion, community mobilization, and other needs. I did tell you before that we also have persons suffering from mental health conditions that are included in the commission. So we expect that the commissioners will prepare a report with key recommendations to improve mental health in the Americas and to transform mental health systems and services following the COVID-19 pandemic. I expect that the report will be completed in the last quarter of this year, and we are planning to bring this report to the attention of member states at the Pan American Sanitary Conference in September, and to put forward some recommendations so member states can agree on, and that we shall have a resolution that will lead to these strengthened mental health services within a transformed and resilient health system. Thank you so much again for this question, but more so, let me thank each of you for having joined us today, and we look forward to seeing you again in the near future. Thank you so much.
Thank you very much, Director, for the final words on this very important and timely initiative. Llegamos, colegas, al final de nuestra sesión.
Colleagues, we have reached the end of today's session. We have covered many topics, and we are open to any follow-up questions from the media. You can obtain information on our website. I think that our colleague has shared some of the frequent questions on hepatitis, and clearly you can send an email to us with the media team at PAHO.org, and we will address as soon as possible your questions. Also, on our website, we have many resources for you, and we are here. We will probably see you in 2 weeks, but please be alert to the notices we emailed you. Thanks again for connecting and for your participation, and have a good week or 2 weeks. See you next time. Thank you.